Hi, Melina.
Hey,
How are you?
I'm good. How are you?
Good. I'm so happy to have you today. So, Melina, Mel, for me, because she's my friend since high school, so she's a physiotherapist. So today it's her time to shine. So, Melina, I have a first question for you. Can you describe your profession? It's simple.
Yeah, simple but kind of hard also sometimes. I'm a physical therapist. I currently work at Concordia Physiosport in Laval, which is a private clinic, but I'll give you a more overview of what a physio is.
Yeah.
So a physio is a healthcare professional who evaluates and treats people with physical disorders. And we do this in order to increase their physical capacity, make them more independent and functional, increase their quality of life, and boost their overall wellness. We are experts in the body and in movement. And using our knowledge, we're able to use a combination of exercise, hands-on techniques, patient education, and modalities to help our clients and assist them in achieving the rehabilitation goals. So to give you a more concrete example of what I do,
Yeah.
so somebody comes to see me, a client, a patient, so they just had something going on with them. So it could be they just had surgery, they have back pain, they had an injury at work, a car accident, peu importe. They come see me, and that first day we do a full evaluation together to get a better picture of what's going on with their condition.
Yeah.
Based on that evaluation, we formulate together a plan of treatment. So this plan of treatment is, what are we going to do in order to achieve our goals? Is your goal to be able to walk without pain, to do stairs, to have more strength in your knee, etc.? So we build up goals and steps of how to achieve those goals, making you more independent, more functional, and basically getting over your physical impairments.
Oh, that's very interesting. So it's basically like make sure that the person, like the well-being of the person, it's in the long term, it's nice, so they can
Yeah.
be autonomous.
Exactly. So you see them for a long period of time. It's not
Yeah.
just, you see them once and that's it. You build a relationship with them, you build a good rapport, and you can see them for months on end until they achieve their goals and they don't need you anymore.
Oh,
Yeah.
that's very good.
Yeah.
So the second question that I have for you is basically, can you name like three things that are less known by the population when it comes to physiotherapy?
Yeah, so I would say one of the things that people don't know is that we are part of a professional order. We're part of the OPPQ, which is l'Ordre professionnelle de la physiothérapie du Québec. So this ensures that there's a form of regulation of the profession in question and that every member has the specific training and skills necessary to practice that profession. In fact, all physios now require a master's degree to perform physical therapy. So I can assure you that during the bachelor's, which is 3 years, and the year and a half master's, you
Mm-hmm.
gain a lot of theory of the human body, but you also gain a lot of hands-on experience. So you have lab components at school where you're learning physical techniques, how to treat patients, but then you also have clinical placements where you're placed in either clinics or hospitals, rehab centers, where you're taking that theory and you're using it on actual patients with the guidance of your supervisor. So by the time we graduate, we
Yeah,
have all the skills necessary.
that's a lot of study, yeah, like because the
Yeah,
undergraduate study is like 4 years, no, if I'm not mistaken.
yeah,
And
it's 3 years. Yeah.
okay, and then after that you have the master, which I think it's 1 or 2 years, no?
Yeah, roughly a year and a half. Yeah. So you have like 4 clinical placements and a master's project during that year and a half.
Oh, that's interesting. I didn't know.
Yeah.
That's very interesting. So thank you so much, Mel, for these information. But I have another question for you. So can you name three things that are less known by the population when it comes to physiotherapy practice?
Yeah. So another thing that many people don't know is that, well, I'm talking about the private sector because I work in the private sector.
Yeah.
You do not need a referral to come see a physical therapist. So yeah, many people think, oh, I have pain, I have to go to the doctor, they give me a prescription, and then I go see a physio. That's not actually needed. You can come directly to a physio because we're able to do a full evaluation and basically tell you what our clinical impression is.
Yeah.
And we also know the limit of our scope of practice. So we know when to refer to another professional or to refer back to a doctor if we need imaging like X-ray or MRI. Yeah.
Okay. That's interesting. Do you have other things that are less known by the population?
We have something that's a bit newer nowadays. Physios can actually now prescribe X-rays. So this wasn't part of my formation when I was in school, but it's being offered as a continuing education course.
Yeah.
I haven't done it personally, but I have a lot of colleagues that are doing it. And there's obviously a bunch of clauses that go with it. So you have to have a referring physician so that the physician receives the X-ray results. And you have to go do the X-ray between, I think, 48 and 72 hours since the injury. So you can't prescribe an X-ray for anybody. It has to be, you have to have sound cause to prescribe it. But I think it's an interesting thing that's happening because it's also a way to offload the emergency rooms nowadays.
Yeah.
You know, if you were playing soccer and you twisted your ankle and you don't know if it's broken or not, instead of rushing to the hospital, you can always just go see your physio and they can determine if there is a need for an X-ray or not.
That's interesting. That's very interesting. I didn't know that. Like, I've learned something today. So, sorry, I have a lot of questions for you. My next one is, when will somebody need your service, for example?
Well, literally physio, you can need physio from the day you are born until your last breath. Literally, okay. Because so many people think that all we do is ortho and sports and that's it. But that is completely false. There is so many different specialties out there that you can literally need physio for anything in your life. So for example, I work in orthopedics. So it's all musculoskeletal injuries, meaning anything to do with muscles, bones, ligaments, tendons. So this could be somebody who just had knee surgery, a shoulder tendonitis, a frozen shoulder, tennis elbow, back pain, herniated discs, etc. Okay. Another main branch is neurology. So anything to do with the brain. So the first one that comes to mind is stroke or traumatic brain injury.
Yeah.
There's cardiopulmonary, so anything to do with the heart and lungs. So this could be asthma, COPD, emphysema. And obviously nowadays with COVID being so big around us, COVID obviously deconditions the person and affects their lungs. So physio in cardiopulmonary is huge right now for that. There's pediatrics, so anything to do with children's development. So it could be global developmental delay, integrating your reflexes, juvenile arthritis, torticollis, anything like that. Something that's a bit more new is pelvic floor physical therapy. So this is anything, anything, oh, not even women, it could be men also. So anything to do with, you know, pelvic floor, your private areas, your genitals. It could be women who are pregnant, people who just gave birth. It could be problems with incontinence, whether it's urine or feces. It could be pain during intercourses. It's literally, it's a very big spectrum and it's gaining a lot more knowledge nowadays because it's becoming less and less taboo also.
Because I didn't know this information, because for me, like you know, pelvic training was after let's say a mother just delivered, and then she was just to make sure that the pelvic gets more straight.
So now I have a friend who's a pelvic physio, and she has pregnant women come to help them deliver, basically how to contract your diaphragm but let your pelvic floor be relaxed to help the baby come out. So it's a whole new area, which is very interesting.
I didn't know. Okay. But you already answered the next question, but I will still ask you because maybe you have like other areas. So where are the physiotherapy services into the healthcare system of Quebec? It's very large as a question.
It's very large and we're a bit everywhere also. I'll give you like the main ones. We're obviously in hospitals. So any inpatient rehabilitation. So somebody who just had surgery or somebody who just had a stroke, somebody in the ICU as well will be present for them. We're in rehabilitation centers. So basically, when you're stable enough to be transferred from the hospital to a rehab center, whether it's inpatient or outpatient. We're in private clinics, such as myself. I work at a private clinic. You can come see me. We are in CLSCs for home care, so people who don't necessarily have the mobility to leave their houses.
Yeah.
We're also found in schools and in sports teams.
Oh, yeah, you're everywhere.
Yeah, we're literally everywhere. Okay.
Everywhere. But thank you so much, Mel. That was so interesting. But if you have a last word, like a word of encouragement for someone who would like to practice in the long term as a physiotherapist, do you have any encouragement to give them? Or yeah, that will be nice to hear, and it will be a push for them.
Yeah, of course. So I know that the schooling is long and the studying is tough, but being a physical therapist is such a rewarding profession. You see your clients very often and you build a great bond with them. So you're with them every step of the rehabilitation journey. So there's no sweeter feeling than, helping somebody who's deconditioned relearn how to walk, or giving somebody a day where they don't experience pain, or somebody who just had knee surgery back to playing the sport that they love. You know that you had a big role in their recovery and an impact in their quality of life. So it's such a rewarding profession. And the ultimate moment of being a physio is when your patient describes you, goes from calling you the physio to my physio.
Yeah, because you have a bond.
Yeah, it's the best feeling. Yeah.
Oh, that's perfect. So thank you so much for accepting my invitation, for being part of this project. I'm sure that people will look at this capsule will be very interesting and about the physiotherapy, about your profession. So
Thank you for having me. Thank
yeah,
you.
you're welcome, dear. So take care and
You
bye.
too. Bye.
Bye.